In today's video, guys, we're going to be talking about the gingivectomy procedure. So this is a procedure which is done usually when we have a hyperplastic gingiva. So in this case, it results in pseudo pockets because of the overgrowth of the gingiva. When you use a periodontal probe to check the bottom of the pocket or gingival sulcus, it's going to be above 4 millimeters just because of this enlarged gingiva. And it can even be greater. It can be 5, 6, 7, depending on how hyperplastic the gingiva is. So one of the indications is to eliminate pseudo pockets. It can also be done if we want to create a more aesthetic appearance in the anterior when we have kind of like a gummy smile, so the patient wants to expose more of their tooth. Or if we want to expose a more sort of subgingival preparation if we're making crowns or veneers. So that's when a gingivectomy can also be done. The instruments that we use for the gingivectomy are special pliers for marking the pockets. We also use scalpel blades. There's different types which can be used for a gingivectomy procedure. Or we can use gingivectomy specific knives, and in some cases scissors can be used just for minor contouring. So that's the equipment that we need. I mentioned the pocket marking pliers at the beginning, so these are used to mark certain bleeding points, and you can use them with Goldman Fox marking pliers or Crane Kaplan. So the way it works is one arm of the pliers is put inside the pocket, the other arm is kind of outside the pocket, and it has a sharp inward point. So when you squeeze it together, it connects together, and through the gingiva it basically makes a mark which starts to bleed. So you insert it to the bottom of the pocket, squeeze, and it marks the base of the pocket. Once you mark the base of these pockets using these pliers, it then gives you a reference point for your incision because you've marked the base of the pocket. So for the incision, depending on which scalpel blade you're using, you can use a number 11, a 12D scalpel can be used. You can also use specific gingivectomy knives like the Kirkland knife or the Auburn knife. So it's entirely dependent on the clinician which one they use. But you're going to make a continuous incision across the entire surface. So you've marked the bleeding points. We make this continuous sort of scalloped incision. It's going to be at an angle of 120 degrees to the tooth axis. We try to avoid doing horizontal incisions in this case because the contours start to look kind of like balcony like, so it's usually something we try to avoid. Also, exposure of the bone should be avoided just to prevent post-operative pain and delayed wound healing. Once we've removed the excess tissue, we can do some minor adjustments just to shape the area as we need. Now that we've exposed more of the tooth surface, we can proceed with some scaling and root planing to ensure that the tooth surface is smooth and clean. It's a perfect opportunity to debride that area now that we've removed the tissue. A dressing is usually placed, a periodontal pack. It's usually replaced after 1 week. The patient is instructed to use chlorhexidine mouthwashes between 0.1% and 0.2%. Twice a day it needs to be done, and then when the patient feels the pain has subsided and they're more comfortable with the area feels a bit more comfortable, then they can continue with their normal oral hygiene routine. So after a week, the patient returns just for a checkup, and we clean the wound surface. Any fibrin remnants and epithelial remnants we kind of just remove off, and then we apply a new periodontal dressing. The normal healing period for a gingivectomy is between 2 to 4 weeks, but the patient must be monitored weekly just to ensure healing is going appropriately and to replace the periodontal packs. To end the video, I'm going to show you guys a nice before and after picture of a gingivectomy procedure. So this has been done by Dr. Teresa Vieira. I think that's how you pronounce her surname. Yeah, you can see in the before picture that really hyperplastic gingiva really covering the neck of the anterior teeth. Really doesn't look very aesthetic, especially you can imagine when the patient smiles. When you have excessive gum tissue like that, it can really contribute towards a gummy smile. And we have the after picture on the bottom. Very nice picture, very nice quality of picture as well. But you can really see the contour of the gingiva is much more appropriate, and this is the type of result that you can get with a gingivectomy. So that's all for the video today, guys. If you have any questions, please write them in the comment section below, and I'll do my best to reply to you guys as soon as possible.